everyone, so let's move towards our today's topic, which is,
in this lecture we will gonna talk about the walls of the nose. Now if you see the nose from the anterior side or from the facial side, you will easily see that basically the whole nose is is divided, or basically there is a medial wall or the middle wall which is dividing the nose into two parts. As you know, there are two nostrils, so between these two nostrils you can easily see there is a wall inside the nose, and that wall is basically dividing the nasal cavity into two half, right half and the left half. Now that middle wall is called as nasal septum. That nasal septum, the anterior most part of the nasal septum, is formed by fat, okay, and that part which is formed by fat is called as columella. This is a very most important point. And the remaining part of the nasal septum is formed by ethmoid bone as well as the vomer bone. नेज़ल सेप्टम का टॉपिक यही है, लेकिन अगर मैं बात करूँ लेटरल वॉल की तो थोड़ा सा आपको समझने की ज़रूरत है. पूरी की पूरी नोज़ है, बीच में जो वॉल है, बीच में जो लाइन है, बीच में जो पार्टीशन है, दैट इज़ नेज़ल सेप्टम. जो साइड का जो सेप्टम है ना, साइड की जो वॉल है, साइड की उसको तो कहते हैं लेटरल वॉल है, लेकिन साइड में आप देख सकते हैं कि नोज़ का जो रिमेनिंग रूफ है वो बेसिकली दो वी शेप का स्ट्रक्चर है बेसिकली, विच इज़ फॉर्मिंग द लेटरल वॉल. एंड दोज लेटरल वॉल, देयर आर टू लेटरल वॉल्स इन नोज दैट इज़ सेपरेटिंग द नोज फ्रॉम द ऑर्बिट. ओके, ऑर्बिट के बराबर में हमारे स्कल में दो ऑर्बिट्स हैं, दो आईज़ हैं, दो ऑर्बिट्स हैं, तो उन ऑर्बिट्स के बीच में नोज़ मौजूद है. ओके, अब राइट ऑर्बिट भी है, लेफ़्ट ऑर्बिट भी है. लेफ़्ट ऑर्बिट से भी नोज़ सेपरेटेड है, वहाँ पे भी लेटरल वॉल है. और जो लेफ़्ट ऑर्बिट है या लेफ़्ट ऑर्बिट से भी सेपरेटेड है, राइट ऑर्बिट से भी सेपरेटेड है नोज़, तो दोनों जगह से सेपरेटेड है. एंड दैट सेपरेशन इज़ थ्रू द लेटरल वॉल. इट इज़ वेरी सिंपल. ओके, नाउ अब लेटरल वॉल भी हो गई, सेप्टम भी हो गई. अब ये नेज़ल कैविटी में पोस्टीरियरली मैंने आपको कहा एंटीरियर मोस्ट पार्ट इज़ कॉल्ड एज वेस्टिब्यूल, इन विच हेयर्स आर प्रेजेंट एंड दोज हेयर्स आर कॉल्ड एज एब्रेसी. Behind the vestibule part, the middle part is called as atrium. Behind atrium, the posterior part of the nasal cavity consists of the bony projection from the ethmoid bone, and those bony projection or the bar-like projections are called as conchae. And this is the new topic for you. I have told you the posterior part is called as conchae. Okay, why that part is called as conchae? Because in that part there is a bony projection from the ethmoid bone, bar-like projections, bar-like bony projections from the ethmoid bone, and that bony projection is called as conchae. And below each conchae there is a passage called as meatus. Okay, now remember one more point, the conchae. Why conchae is present? The professor or the teacher or anyone can ask you, why conchae in our nose is present? Because to increase the surface area of the nasal cavity, because the more the surface area, the more the air will stay in the nasal cavity. And when the air will stay in the nasal cavity, that air will be there is a higher chance that the air will get more warm. Okay, so basically this is the concept, and this is the main concept you have to remember. Now the conchae are also known as turbinates, and like I said, these are the bony projection. Now there are some meatus, like I said, the passage below each projection. Number one, meatus is superior meatus. Below that, middle meatus, and below middle meatus, inferior meatus. But these meatus are like I said, that these meatus are present below the concha and that corresponding concha. So the first concha will be superior concha. Below superior concha there is a meatus called as superior meatus. Then superior meatus, after superior meatus, below superior meatus there is a concha called as middle concha. Then after middle concha there will be a meatus called as middle meatus. Then after middle meatus there will be a concha called as inferior concha, and after inferior concha there will be a meatus called as inferior meatus. And below inferior meatus there is a floor of the nasal cavity. Simple. Now this is very easy, but you have to also remember that what sinuses are opening in these meatus. Okay, now what is sinus? First I will tell you that साइनस इज बेसिकली क्या होता है कि साइनस जो है ना होल होते हैं, हॉलो स्ट्रक्चर होता है, पूरी एक सॉलिड बोन है लेकिन उस सॉलिड बोन में कोई हॉलो एरिया है, कोई स्पेस है, एंड दैट स्पेस इज फिल्ड विथ एयर, सो दैट इज कॉल्ड एज साइनस. ओके, सो there are sinuses near the nose, and those sinuses are like, I will tell you, there are 6 sinuses which are present near the nose, and those sinuses are connected with the nasal cavity, and those sinuses are opening in that meatus, and you have to remember that which meatus you have to remember that which sinus is opening in which meatus. This is very important. Now there are, like I said, there are 6 meatus. There are 6 sinuses. The frontal sinus, which is present in the frontal bone, the sphenoidal sinus, which is present in sphenoid bone, the maxillary sinus, which is present in the maxilla below the orbits in maxilla bone, and there are ethmoidal sinuses, 3 ethmoidal sinuses which is present in the ethmoidal bone, and which are named as anterior ethmoidal sinus, posterior ethmoidal sinus, and the middle ethmoidal sinus. Now how will you remember that which sinus is open into the in which meatus? Like I said, you know that superior meatus is present between superior concha and middle concha. The middle meatus is present between middle concha and inferior concha, and the inferior meatus is present between inferior concha and the floor of the nasal cavity. Okay, now how will you remember the sinus, which sinus is opening in which meatus? Now I am telling you. The middle meatus consists of all the sinuses, all 6 sinus, the all sinuses which I have told you. I told you there are 6 sinuses. Okay, now remember this wording: all sinuses are opening in the middle meatus except, the wordings are, I am repeating again, all sinuses are opening in the middle meatus except posterior ethmoidal sinus and the sphenoidal sinus. Okay, when you will remember this wording, it will be easy for you, because the middle meatus consists of 4 the 4 sinuses are opening in the middle meatus: anterior ethmoidal sinus, middle ethmoidal sinus, maxillary sinus, and the frontal sinus. But the sphenoidal sinus is opening in another side, and the posterior ethmoidal sinus is opening another meatus. लेकिन जो रिमेनिंग 4 है वो तो मिडल मीएटस में है. तो अगर आपको ये वर्डिंग याद हो गई कि ऑल द साइनसेस आर ओपनिंग इन द मिडल मीएटस एक्सेप्ट पोस्टीरियर इथमोइडल साइनस एंड स्फीनोइडल साइनस, सो इट विल बी इजी फॉर यू टू मेमोराइज दिस. ओके, एक्सेप्शन याद कर लेंगे तो आपको सब कुछ याद हो जाएगा. नाउ सुपीरियर मीएटस में कौन सा साइनस ओपन होगा? पोस्टीरियर इथमोइडल साइनस. ओके, एंड इट इज़ द शॉर्टेस्ट मीएटस एज वेल. एंड द मिडल मीएटस, लाइक आई सेड, 4 साइनसेज ओपन हो रहे हैं और आपको वो वर्डिंग याद हो जानी चाहिए. एंड द इंफीरियर मीएटस इज़ द लार्जेस्ट मीएटस and it consists of lacrimal fold. Now the remaining sinus that I have told you, that's sphenoidal sinus. So sphenoidal sinus will open above the superior conchi. Now above the superior conchi there is a space, there is a recess called as sphenoethmoidal recess, which is a triangular fossa, and in that fossa, basically in that recess, there is an opening of the sphenoidal sinus. Okay, now this was the whole topic regarding conchi, and further we will discuss in the next part. Okay, till then, work hard, study hard, and good luck. Bye, thank you.